Good afternoon, everyone, and thank you for joining us this afternoon for our next event. I'm Sean Godar, Vice President of Strategy and Analytics at Employers Health and Co-Director of Right Direction. I will serve as moderator of this event. We are really excited to hear from today's speakers. Before we begin, a few housekeeping items. All attendees are currently in listen-only mode. Please send any questions you have using the question function in your control panel. We look forward to addressing your questions at the end of the presentation. If you ever have any difficulties hearing any one of us, please raise your hand in the control panel and we will be in touch to assist. Upon exiting the webinar, you will receive a survey to provide feedback, and we appreciate all attendee feedback in order to provide future valuable education opportunities for upcoming events. We will also send out a follow-up email with a link to a recording of the event and its accompanying and any other accompanying material. Submit your questions at any time in the chat function, and we will answer those during the Q&A. Now, it's my pleasure to turn it over to my colleague, Darcy Gridaro, who is the Director of the Center for Workplace Mental Health and Co-Director of Right Direction. Thank you, Darcy.
Thank you, Sean, and good afternoon, everyone. We're really excited this afternoon to bring you an all-star panel of impressive experts on a topic that's truly on the minds of so many. You'll hear about the role of race, mental health, and equity are playing in the workplace and how successful organizations are placing a high priority on these issues. This topic could not be more timely as race is in our daily headlines and our nation grapples with unthinkable tragedies that impact all of us, at home, at work, and in our communities. Workplace mental health was a concern leading up to the pandemic, but has moved to be a top priority for employers of all sizes, as we see growing rates of depression and anxiety tracked by the CDC and others. Before we turn to our speakers, I'd like to share a little bit of information about Right Direction. Right Direction is a partnership that is between the APA Foundation Center for Workplace Mental Health and Employers Health. It is a high-impact turnkey initiative designed to raise depression awareness, reduce stigma, and promote help-seeking behaviors. You can see there, rightdirectionforme.com is the website for the materials that have been developed that are very simple for employers to use, to customize, and we really encourage you to go there. We recently added a new resource on gratitude in the workplace that includes strategies that a number of employers have used to address this topic, along with last month's virtual town hall on addressing loneliness and isolation. Through Connection, we had Dr. Nobel here, and it was an excellent presentation with great attendance. And we've also had several other virtual town halls. So we strongly encourage you to visit the website and gather some of the information that we have available and have designed for you. So if you go to the next slide, I'm going to share with you today's really impressive panel of presenters. First, we have Dr. Corinne Glover. Dr. Glover is an assistant professor at Albert Einstein College of Medicine and an attending physician in adult outpatient psychiatry at Montefiore Health Systems. She's also an advisor to the center and a member of the APA Foundation Board of Directors. So we have the opportunity to work with Dr. Glover, and you are likely to see a whole lot more of her. She seems to be everywhere all the time doing amazing work in addressing this very topic. Our second presenter today is Claire Miller, who is Life at Mental Health Program Manager for Facebook. She also happens to be the former director of the Partnership for Workplace Mental Health, which is what the center was formerly, and also one of the co-creators of Right Direction. So she has a long history with this initiative and did a wonderful job with her partner Marcus Miles, formerly of Employers Health, in developing Right Direction and setting us on a great course for really growing the initiative. And then also we have Barbara Furlow-Smiles, who's the lead strategist and global head of Facebook resource groups and employee engagement. We know how important these topics are to employers. We're hearing more and more about forming resource groups around mental health and race-related issues and the importance of those in employee support and frankly in employee engagement as well. We are so pleased to have them joining us today, and we are extremely fortunate. So with that, I will turn it over to Dr. Glover.
All right. So, hello everybody, and I thank you, Darcy, for that wonderful, warm introduction. I have always appreciated how supportive you've been of my growth and of my voice. So, with that, I think it's important to get started and let you guys know that this couldn't be happening at a more important and powerful and impactful time. So I hope that a result of this talk is some more internal dialogue and dialogue amongst colleagues about what more we can be doing to protect our employees and our patients. And with that, let's get started. Next slide. So objectives for today, we're going to explore ways companies have historically handled DEI issues, understand why current times necessitate a new approach, and look at some innovative approaches for retaining talented and diverse applicants. Next slide. So the rationale, I always think it's important to say, like, why should we be intentional about hiring diverse talent? And so I think part of it is just this basic acceptance I think we're all starting to come to, that people of different backgrounds sometimes live very different realities, right? That we are now coming to terms with the loss of another unarmed Black driver. In this case, it was Dante Wright, who was killed in Minneapolis by an officer. And this, I'm sure you know this by now, but this is not new. I am in my 40s, and since childhood, I belong to a community. I am African American. I wake up every day in a Black body, and since childhood, counting the dead, the innocent dead, has been part of our community communication and community grief. And yet I knew growing up that I was never to talk about that at work. I knew growing up I was never to talk about the stressors that my two older brothers faced when dealing with law enforcement in the course of, like, going to work or going grocery shopping and going to Blockbuster, for instance. I knew I was never to talk about that with people who did not experience that reality regularly, because I knew I would not be believed, and I knew that in turn that could tank my career. So I hope you can appreciate, all of us today, that we are at a moment in history where we are reckoning with things that we had previously been silent about. Maybe raised our voices in protest, but not talking about in the workplace, and certainly not able to secure the kind of attention that we're giving this topic right now. That racism can have an effect on multiple parts of our health, our mental health, our physical health, and our work performance. So it is right, it is just to talk about diversity. It is also economics, that young people are paying attention. At this point, 35% of young consumers no longer are buying from companies they deem unresponsive or harmful to diverse populations. And approximately 70% of Americans believe brands should take action to support voters. Next slide. So workplace mental health intersects with discrimination. And what do I mean by discrimination? So discrimination is a biopsychosocial stressor. It's the product of environmental interactions that can lead to negative psychological outcomes, especially when discrimination is perceived as demanding, threatening, or uncontrollable, right? When the word control comes up and the perceived loss of control or loss of life or loss of health comes up, that's when the word trauma starts to enter the conversation. Next slide. And so again, when we talk about discrimination, we're talking about lots of different kinds. We're talking about the kind that's experienced at a population level. For instance, various traumas that have happened to different communities in this country: Japanese internment camps, forced sterilization of Puerto Rican women for decades during the 50s, 60s, and 70s, forced sterilization of African American women for that same amount of time, if not longer. But then there's also the kinds of trauma like we're experiencing when innocent Black people are killed by law enforcement, or the kind that we experience in the workplace, which is perhaps less perhaps more benign, but nonetheless harmful, the invisibility that comes with being in an ethnic minority, or perhaps a disabled person in the workplace, or somebody who is going to work knowing that their job environment has not commented on the racial trauma and the cumulative effects of racial trauma on certain populations. And then there's othering, and then there's microaggressions along the lines of, when you wear your hair natural, Corinne, you look wild. So we prefer you wear your hair straight. These are all things I have heard in the workplace. Next slide. So Darcy asked me some really big questions, and so I'm going to do my best to tackle some of them, but not all of them, because these are huge topics, Darcy. So the first one is about how do we build strong DEI in the workplace, and how does it impact employee mental health and well-being? So next slide. So I think we have to start with hiring. I think it's important to know that there are certain ways that our society has focused on hiring. We've relied very often on our own social networks to find people, alumni associations to find qualified candidates. But from what schools, and do we have a pipeline? So next slide goes into that a little bit more. And so this is from actually leanin.org, and they talk about the importance of ways to secure diversity in hiring and promotion. And these are 5 very concrete steps that resonated with me. Before I went into psychiatry, I actually worked in marketing at Verizon. And I think corporate environments are places where we rely very heavily on social networks for hiring. And often compensation is not tied to finding diverse candidates. And so part of I think the work these days is around finding diverse candidates, putting evaluators through unconscious bias training, using clear and consistent review criteria. And number 4 is the one that jumps out the most to me, which is making resumes and assignments anonymous. So there's one study, there's actually more than one study, but one study in particular stands out that it replaced stereotypical Black sounding names with stereotypically white sounding names on a candidate's resume. And it resulted in 50% more callbacks, the equivalent of adding 8 years of work experience. And I know that sometimes we say in the workplace, well, we just can't find any minority candidates who are qualified. And so that sort of begs the question of, who are you looking for? How are you finding them? And then what happens when they arrive for the interview? And what happens if they are hired? And so there has to be really intentional action around removing the ethnicity or the ethnic signifiers of people's names, if you're really dedicated to sort of being blind in the process at any point. And then number 5, I love this, appoint a criteria monitor, where essentially somebody from HR, it is their entire job to sit in on hiring and promotion conversations to make sure that people are focused on the criteria for the role. I've had the distinct pleasure of being friends with people who are allies, and they have told me when it came to hiring Black candidates, somehow people felt like they needed to look up their transcript one more time just to make sure it was true. We need one more reference on this person just to make sure that we're not making a mistake in hiring this person. And no, this has nothing to do with race. We just need to know. And so I offer these to you as ways to not only boost the sense of allyship in the workplace, which is on a future slide, but also to give concrete ways to reconsider diversity and also to think through some of its impacts. Next slide. So the idea is to not only hire diverse talent, the idea is to retain diverse talent, which requires another criteria. So these are for women, Latina women CEOs. They are from various corporations, and I just Googled Latina CEOs. And it was a really interesting Google search because there aren't that many. So in any event, next slide. So I think previously the tone had been, right, we've hired some Black, brown, disabled, whatever, marginalized, folks with marginalized identities, some folks from the LGBTQ community, some Asian Americans. We've hired these folks, but then we're going to essentially say we don't talk about politics in the workplace. That's something I heard very often. The hard part with saying we don't discuss politics in the workplace is that part of being a marginalized person means that you are socialized for how to survive being in the minority, how to thrive while being in the minority. And that means navigating the sensibilities of the folks who are in the majority. And so that means that people in the majority may think, oh, that's just politics. But for us, for Blacks, Asians, Latinos, folks in the LGBTQ community, we're actually talking about our survival. We're talking about how do I get home without being pulled over and killed? How do I look at what just happened in the news and knowing that after an unarmed Black motorist is killed by police, there are symptoms of depression in the community for at least 90 days after that. And so we're not just talking about those Blacks over there who feel down after somebody like George Floyd is killed or Breonna Taylor is killed. We're talking about people like me. And how are we going to get through the day and focus in meetings when we think to ourselves, I'm related to somebody who could be killed. I wake up in this Black body every day. How do I make sure that it's not going to happen to me? So for a large portion of marginalized folks, these conversations are not about politics. These are about how do I live? How do I continue? How do I maintain hopefulness? How do I envision a future for myself and my loved ones? So in any event, and there's a whole set of skills that come from having those conversations. Next slide. So that's where the role of allies come in, because allies are the folks who are standing up for the equitable and fair treatment of people different than them. They're speaking out against racism or discrimination at work. They're challenging bias and other harmful assumptions. It's the allies who are able to distinguish between a conversation about politics and a conversation about survival, a conversation about equity, a conversation about equality, and is willing to sort of strategize where possible to make sure that everybody's being heard. The ally is the person who notices that a woman is being talked over in a meeting and says, hey, you know, I noticed that Megan said something. I'm not sure we all caught it. Megan, can you say what you said again? And so it's that kind of behavior that helps a marginalized person feel welcome in the work environment and not feel invisible. It helps that person feel like there's a future for them, that they are valued, and also keep some of the depression symptoms and the anxiety at bay. Next slide. So what are we doing to train our managers to be capable allies? Do they know how to listen to distress? Do they know to direct employees to the EAP? Do they know how to maintain good boundaries also? Because that's part of this as well, right? That once you listen to somebody express distress, you also have to be able to draw a line and say, you know, here's where I think talking to a professional could be helpful because I am still your boss or I'm still your manager, and I want to keep our relationship related to the work environment. And then there's also, are your folks trained to consider risk management when listening for the distress of somebody, anybody, not just a minority or marginalized person in distress, but also to think in terms of what does my office environment need versus what does this person need, and how can I make sure that good boundaries are being maintained so that this person can perform to their highest capacity, but also they're not putting themselves in jeopardy by showing their distress unless they want to, right? And on their terms. And if it's not, then how can we make sure that people's needs are being taken care of? Next slide. So I think it's important to wonder, right, do your diverse employees know where to find a therapist who they can trust, will be anti-racist and anti-biased? Are the folks in the EAP, essentially, right, the Employee Assistance Program, are they skilled technicians, skilled clinicians who know how to help folks from marginalized populations navigate some of the social determinants of health, right? And then how long does it take for them to find help? And can I connect my employees with structurally competent self-management tools? And how are we going to help them cope in between visits? And if you've got on-site mental health, is it anti-racist, right? Because it's not necessarily that race is a problem. I mean, race is a construct and race doesn't really exist. We're 99.9% similar as human beings, but it is racism that has the impact on our lives and our health. And then the final thing, which I think is the part that's the most innovative, is are we gathering health data on our diverse stakeholders? Are we working with the health insurance companies to make sure that our work environment is not contributing to the stressors that are affecting our folks from marginalized populations' health? So next slide. So I'm gonna circle back and just say that to underscore that when it comes to hiring and maintaining a diverse workforce, you've got to tie it to compensation. It just turns out that people lose their desire and their commitment to this because they're pulled in a million directions. They're going to always reach for the familiar. And we've all got biases. So it's important to tie compensation to diversity. And I think I just want to underscore in this moment that there is so much data that shows that people who are exposed to discrimination in multiple domains of their life, so the person who wakes up in the morning and checks the news and finds out that George Floyd or Breonna Taylor was killed, or that Dante Wright was killed, right? And then they're arriving at work and they pull into their parking space and the security guard sees a Black or brown person in a space that says that's designated medical director or vice president, and they say, is this your space? Is this where, are you here? Are you just pulling in? Are you dropping off something, or is this actually your space, right? So just microaggressions. And then they walk into the workplace and somebody says, it's curly. I like it so much more like it when it's straight. I like it when I don't understand this style here. So that's like three major things that can happen in the course of a day, and that's just the beginning, right? And so it's the cumulative effect of that, and then trying to sort of tie your resolve to just sort of keep on going and put on a happy face to get through the workday, that's actually associated with higher blood pressure. It's associated with some glucose metabolism abnormalities. And so we're not surprised that people develop, who are going through these kinds of things, greater abdominal fat, or have trouble managing their diabetes, or may gain weight, or may have hypertension. Next slide. So I always trumpet the efforts of Kapoor Capital because they have been very, very intentional about hiring people of diverse backgrounds, folks who are willing, their staff is willing to work on pipeline programs with kids from all backgrounds in different communities, historically underserved communities. Next slide. And they've been quite explicit about making a statement, having a plan, and not relying on their diverse talent to do the work for them, right? The idea is to make sure the diverse talent at work gets to actually just focus on work and surviving what for many of us is racism in our society. And then Kapoor Capital is investing heavily and specifically in educational opportunities for students of color. Just like I said, that's what I mean when I say pipeline programs. Next slide. And so I hope I'm underscoring for all of us that the healthcare needs of some of the Black and Latino populations, some of our trans community members, some of our Asian American community members may change based on what's happening in the news. That again, people will undergo lots of self-management efforts, like eating, like maybe having an extra drink or an extra warm carb after dinner, or just as a snack or whatever. But some of that can be harmful to our health if we're doing it in a chronic way. And so how are our benefits designed to help people maintain sort of that middle path, that path of some good health behaviors, and what are we doing to accommodate folks who are perhaps religious minorities? We're at the beginning of Ramadan, and do we need to think in terms of, well, if this person was up praying, right, after they, especially because daylight is lasting longer, that means that this person is going to have to wake up and go to bed late, wake up at 4 o'clock in the morning to eat, and maybe really tired. So maybe we're not going to have an 8 o'clock meeting and expect them to present, right? And maybe what days are they going to need off for Ramadan, for example. Next slide. So when we also think about health, I want to underscore that there's so much data, again, around the impact of racism on health and understanding the impact of repeated effects of structural racism on health, racism in housing, how close we live to a highway where we're exposed to pollutants, how close we, whether we can get a mortgage in a certain neighborhood or not. All of those things add up to Black women having 2 to 3 times more likely risk of dying from a pregnancy-related cause. So if we're hiring a Black woman of childbearing age, we should keep in mind what sorts of services might this person need if we know that she is at higher risk for pregnancy complications, for fibroids, for having to be out for surgery, and what's her recovery process going to be like. Next slide. So I like to talk about the ways that essentially Black and Latino people are really fed up with how medicine is functioning in some ways, in that it's increasingly difficult and frustrating to find a clinician who knows some of this. I honestly, when I went to med school, I was taught that that there were many things wrong with Black people's bodies, that our lung capacity was smaller because we were told that we had longer legs. I mean, this stuff is totally debunked, but I didn't go to med school that long ago. So there's been this whole change in medicine that has not filtered out. So there are doctors out here who are practicing race-based medicine. So essentially, folks in the tech sector were like, look, like, we're done with this. Let's just find a network of doctors who know the things. So there's apps like Health in Her Hue, for example, where you can find a Black doctor, you can find a doctor who's not Black but is an ally who has done the work. Next slide. And just to make you aware that Health in Her Hue, for example, was featured on Good Morning America recently because they got $50,000 from Pipeline Angels. These are Black professionals who pooled their money together to just say, like, we're done with the craziness. We just want to have safe clinical experiences that reinforce our humanity and don't degrade us. And we want to make sure that when folks show up for medical care, that they're taken care of. Again, the legacy of experimentation on Black women and Latino women, the legacy of that looms large in our minds. Next slide. And so I hope that we're all thinking about using a quality lens when we think about programs around diversity and the intersection of diversity, helping serving diverse populations as far as our benefits go, and then making sure that we're actually meeting our target. So I think keeping data on the ethnic background of employees to track outcomes is completely reasonable. I think there's dialogue to have with those employees about why and how it can be useful. I think it's important to, again, acknowledge the nuance that race is a construct, a harmful one, but we recognize that racism governs so many dimensions of the life experiences, traumas, and health outcomes of entire populations. It can't be ignored. Next slide. So yeah, keep on going. There we go. So go back. There you go. Thank you. So the point is, does your DEI dashboard include health equity? When you're thinking in terms of targets for hiring, recruitment, retention, are you also thinking about the health of these populations. Our society is undergoing massive changes, not only because of COVID, but also because we are talking about the impact of racism and discrimination on historically and currently marginalized populations. The health of trans folks the health outcomes for trans folks are shocking. So I want us to, as we think about hiring people of different backgrounds, we have to think in terms of what are the obstacles and challenges they are facing to getting their healthcare needs met, and what do we need to do to support them. Next slide. So I've talked about all of my favorite action items. I'm going to give my slides to Claire, and she can send them out to people if you want. But the idea is to really make it as easy as possible for folks to not only be hired, to stay and feel welcome, and then also to know that when they show up for work, they are not in a workplace that is marginalizing them just like outside society does. There are qualified people, qualified clinicians, qualified employees, qualified resources, qualified consultants, if you are willing to look and do the work. Next slide. These are some of the resources that I look to for lots of really good information. The Forum Workplace Inclusion, their podcast is super helpful, and there's data on workplace discrimination and depressive symptoms. Oberlin, which is a branding company, published some really interesting stuff, as well as leanin.org on the experiences of marginalized people in the workplace and how to retain them, and what brands need to think about in order to make sure that they're doing the work. I think that's the end. Is there one more slide? Yeah, there we go. So I'm going to hand it off to wonderful Claire Miller from Facebook, who is a wealth of knowledge, and go for it, Claire. Thanks.
Thank you so much, Dr. Glover. That was amazing. Wow, I always learn so much when I listen to you present, so thank you. So I'm really, really pleased to be here today, and my role is to talk a little bit about our mental health program at Facebook. And then I'll turn it over to Barbara Furlow-Smiles, my friend and colleague, who will talk about Facebook's work in the diversity and inclusion space, and in particular, our Facebook employee resource groups. So next slide, please. So hopefully you all know who Facebook is. We're not just the Blue app, but we're also Messenger and Instagram and WhatsApp and Workplace and Oculus. I do want to mention Workplace in particular because it's a critical way that we really work at Facebook. Workplace operates, and you'll hear me reference it in my short time with all of you today. Workplace operates very much like Facebook, but it's within the enterprise, and it's really the way that we work at Facebook. It's the way we communicate with employees, and it's really a kind of a critical part of our culture. Next slide, please. And we call our benefits at Facebook Life At, and our mission in the benefits department is really to help care for employees while they're bringing the world closer together, and to really kind of show care. So our highest goal is really for employees to feel cared for from Life At. Next slide. Thanks, Emma, for advancing the slides for us today. Our mental health strategy is built on really 3 pillars, and these are not in any specific order, but they're all kind of equally important. And I'll talk a little bit about each of them. The first is to increase awareness and reduce stigma associated with mental health. The second is to improve access to quality care. And the third is peer-to-peer support, and really where Barbara's work really is very important. Next slide. I'm not going to spend a great deal of time on sort of the basis for these as our 3 pillars of our strategy, but we'll just touch a little bit on some of the kind of key kind of research and underpinnings of each strategy. The reason we want to increase awareness and reduce stigma, and the way in which we do that is really leveraging the literature that suggests that the best way to reduce stigma is for employees to connect with other employees who have lived the experience of mental health. So at Facebook, we believe strongly that it's not enough for us to talk about like signs and symptoms. That is not going to reduce stigma, and in some cases might actually perpetuate or increase stigma. And instead, we have efforts, which I'll get into here in a minute, that really invite employees to share their personal experience related to mental health, to bring people closer together, and to help reduce stigma. In terms of improving access to quality care, sort of the basis for why this is important to us is just the sheer prevalence. Obviously, many of you know 1 in 4 Americans experience a mental illness in any given year, but we know from the research that people often wait a decade before reaching out for help. And so we think it's critical that when people do reach out for help, that help is easy to access, that people have a great experience, and people do not experience the kind of racism that you heard Dr. Glover so eloquently talk about. So really making sure that we're capitalizing, especially on our young population, so that they get care early, and when they get that care, that it's a really, really positive and good experience at a time when people are struggling in their lives or could use some additional support. And then in terms of peer-to-peer support, the reason that's important to us is that we know that people with really shared experience can form community, which can really improve recovery for people with mental illness. Next slide, please. So the way in which we do this work is almost as important as what the work is. We have a great cross-functional team that comes together specifically around mental health. It's considered one of our strategic priorities within the LifeAt team, and it's something that we take really seriously at Facebook. And our cross-functional team really helps to make sure that we're thinking about programs and policies and experiences for employees in ways that are really going to meet the needs of our entire population, as well as specifically our diverse communities. So that XFN, I always have to use my little cheat sheet here because there's actually so many people involved in it, but we pulled together folks from diversity, from legal, human resource business partners, employee relations business partners, compliance, our Facebook resource groups, learning and development, security, folks who focus specifically on resilience for the organization. So they all come together, and whenever we're talking about putting together a new program or rolling something out, we work with that XFN to really make sure that we're thinking and asking all the right questions to make sure that it's going to resonate with our employees, and in particular our diverse populations. The second thing that we do a lot of is really listening and engaging with our employees. We do regular focus groups or listening sessions with employees to either get their reactions to specific programs that we're thinking of rolling out, or just kind of open listening sessions where we ask and invite them to share their experience related to mental health with us. And this is in particular helpful as we think about the employee experience of getting connected to care. We've gotten some of our best insights from these groups. And if you're an employer listening to this, I would really encourage you to prioritize, if you're not already, putting together listening and focus group sessions, because it's just such a wealth of information. We're really blessed in that our employees do not at all hold back in terms of feedback, and we really view that as a gift. We have a very feedback-rich culture, and really invite that people to share their perspectives with us. And then, of course, importantly, we need to make sure that we have the right benefits in place. Next slide, please. You can go on to the next one. So in terms of one of the programs that we've done to reduce stigma, it's a program called Open Up. And really at its heart, it's an invitation to employees to share their experience related to mental health. Now, this could be something like how they stay resilient, ways in which they manage stress, all the way to living with a severe mental health disorder, or how surviving suicide, for example. These stories were posted mainly on Workplace, as well as people sharing in individual team meetings and the like, and then labeled with the hashtag Open Up. And we have more than 150 examples of these stories from our employees since we launched the Open Up campaign. Now, before we launched Open Up, we worked with that XFN to really make sure that it was going to resonate with diverse populations within the company, and then had to course correct, frankly, as we were doing the initiative over the years. We've done several iterations of the initiative, and we realized, for example, that in APAC, we didn't have as many people sharing their experiences and their stories. So we corrected for that in later iterations of Open Up by really doing lots more outreach to that community and to that region to make sure that we had representation from key leaders kind of signaling that it's okay to participate in this initiative and that this is something that's important to be part of. We also provided little laptop stickers, which included kind of the symbol of the Open Up campaign, which is butterflies, symbolizing metamorphosis. And those are ways to kind of signal to one another that you're an ally for mental health. And then we also did ads on Facebook and Instagram targeting our employees, telling them about Open Up and reminding them about the mental health resources available to them. And so this initiative, next slide, please, has been really helpful for us. We were already a company that talked a lot about mental health, and people, I think, felt very comfortable talking about mental health at Facebook because of the culture. But it really kind of took it to another level in terms of having lots of different voices involved in the conversation, talking about their experiences. And again, it was built really on that research, knowing that the best way to reduce stigma is for people to share their experience and to actually connect with others with the lived experience. And so we're continuing to iterate on Open Up, and it's really a kind of a vibrant part of Facebook's culture as it relates to mental health. Next slide, please. And here you see that we know lots of people participated, obviously, in Open Up, and in some cases, people told us that Open Up was actually the reason that they ended up kind of finally getting help after long delays and that decade or more that we know from the research, a lot of people wait before reaching out for help. Next slide. And next one, please. So the next program that I wanted to talk about is really falls into our increasing access to quality care. And one of the chief ways that we do that is through our partnership with Lyra Mental Health. And Lyra operates like an employee assistance program, but it's very different. I sort of think of it as EAP on steroids. For one, the model is very different. It's not 6 or 8 sessions, but in some cases up to 25 sessions. And it provides therapy, coaching, self-care. We added access to psychiatric medication management program in this year. And members can all access free therapy sessions. And folks who are part of our EPO or PPO plan can also continue with their Lyra therapist in the health plan with a copay. And then it offers, of course, the traditional work-life services as well as on-site providers. But what I think is critical about Lyra is the experience of getting connected to care is very different than your traditional EAP. And this is the place where we've really used our voice as an employer. In literally my first conversation with Lyra, I was asking questions about the diversity of their network. How diverse were they? How do people find providers that look like them when they're going to seek care? And how is the product really optimizing for that? And I'm pleased to say that Lyra has been very responsive to those questions and to that kind of perspective of making sure that the experience of diverse populations is a stellar one. They have found ways to really optimize the search function so that you can make sure that you can find a therapist who looks like you in the system. And then they have care navigators available at any point if someone wants additional support with that. So they've been very responsive, and I think are continuing to iterate and build on that in that space. Next slide, please. And so through Lyra, we really have support across the entire mental health continuum, from preventive to early intervention to therapy, of course, care for chronic conditions, and medication management. And one word that I'd add here is that we at Facebook use the term mental health very deliberately. We decided to do that after having conversations with our employees about what we should be calling mental health. Should we use the term emotional health? Should we use behavioral health? What term do they really want us to embody as we talk about this important subject matter? And they said, we'd like you to call it kind of what it is, and it's mental health, and not shy away from it and use some sort of euphemism. And so that's the term that we use in our communications at Facebook. Next slide, please. And so last, and then I'll be turning it over to my colleague and friend Barbara, is peer-to-peer support. And the way in which we leverage our employee resource groups is really to make sure that we're putting messages out about mental health in all of these different communities and making sure that they're seeing them within their community. We have a number of different Facebook employee resource groups. Barbara will talk much more about these. We also have clubs around any number. There's a club for everything. There's a bread club. Which is kind of my favorite. There's cooking clubs, exercise, different kinds of sports club, all different kinds of clubs, meditation clubs, mindfulness clubs. And so we partner with clubs to also communicate messages related to mental health. So we want to basically have the approach of communicating mental health messages and reminding people about the resources at the leadership level, directly from Life at Benefits, and then in all of these different other spaces where employees are showing up, so that you are getting them through multiple perspectives and multiple lenses. We also have a couple of really active workplace groups where people are coming together specifically to talk about mental health and to support one another. One of those is literally called Mental Health At, and you can see it has great membership. It's a really dynamic group. And the second one is Building Resilience. That one tends to be a little bit more focused, of course, on kind of resilience and ways in which people are managing stress and focusing on well-being. So the message here is to consider, thinking of ways that you can reduce stigma related to mental health. Use your power as an employer to ask your vendors tough questions about diversity and disparities, and use your different communication vehicles to really make sure that you're getting messages out to employees in ways that are going to resonate with them. And with that, I will turn it over to Barbara.
Well, hello. Thank you so much, Claire, for that information. I'm Barbara for Little Smiles, and like Claire mentioned, I am the diversity lead for our employee resource groups. The exciting piece is that we're global. So we're all over North America, Europe, Asia, and Latin America. So today I don't have slides because I can understand information overload. I'm very mindful of that because I am that way, but I wanted to really just speak high level about how we view diversity and inclusion here at the community at Facebook. So first is first, if you haven't already seen our awesome diversity website, I encourage you to visit diversity.fb.com. In that site, it gives you all the great stats and information to really kind of explore how we at Facebook view diversity. I can give you and share high level that at Diversity at Facebook, we are structured in three different kind of areas of expertise and buckets. The first is find. How do we help build teams and really just cognitive diversity who are highly qualified people from underrepresented groups of people? The second one is our growing key pillar. So, how do we not only find diverse talent, but then how do we keep and retain? How do people have a pleasant experience? How do we continue to be an employer of choice? And then integrate is one of our newest ones. How do we build our products and develop policies that best serve people in our global community? That one is really, really big for us. So those are the pillars in which we have prioritized how we are organized just as a company as it relates to diversity and inclusion. So what I want to talk about today is what I talk about a community and belonging as it relates to, we call them Facebook resource groups. We have 9 here at the company, which is really exciting, and I'll just share what they are. We have Asian Pacific Islanders group, Black at, Differently Abled at, that's our group, people with disabilities. Interfaith at is our group, which is comprised of people of all faith and spiritual groups, Latin at, Native at, Pride at, Vets at, and Women's at. And really our mission for our community groups is really helping to provide the community support, crucially to achieving our mission of creating a space where employees feel seen, heard, and a sense of belonging. These groups really focus on the characteristics shared by people of traditionally underrepresented and marginalized spheres. For us, it's quite simple, in the framing of what we're talking about mental health. What I'm really, really excited about these groups is, at Facebook, we're all about creating connections, creating community connections, and how are we cultivating community. Claire talked a lot about just really what we do with mental health at the company, but what I wanted to showcase and provide just examples of how our resource groups have played a big role. It is no secret that COVID-19 has fundamentally shifted everything that we've known about the workplace and life. And so that hit our communities very hard. And one of the things that we had to recalibrate is that many people, as it relates to mental health, were struggling. And so we partnered and came together with our mental health team and really looked at ways in which we can create some connections in light of COVID-19, in light of people working from home, in light of people just really juggling in different spheres of just life. And so we created this group called Connect at Circles. And so really what we wanted to do with the Connect at Circles, and it's been a huge success, is having our FBRGs really leverage these circles to build micro communities and share just different resources with them. One of the things that we were really solving for is that there was lack of connections, touch points, lack of physical syncs. Many employees were balancing and challenging personal circumstances, partners who were working in healthcare, homeschooling children, caring for parents at home, family members at a distance. So if you could imagine, there were different things that we were really trying to solve for. The exciting piece is really with launching the circles, we were able to create, like I called, the micro communities of people that resonated, not only just in our main offices, but we were able to scale and start doing these, just Connect at Circles across all of our regions. What we have learned from people and what they have shared is the common thread was this feeling of isolation. The feeling of isolation were literally, we were on lockdown for about a year of not being able to travel. It was like this unknown. And so having this safety net, having this space to connect, this space to be. And so these are just some of the examples that we've done really when it relates to mental health. Claire and I are in deep partnership, as you see in the news, with the different communities who are externally impacted in this layered of trauma. And so one of the things we've also been doing for the Black and Latino communities have been healing circles. So healing circles is really just connecting them with a VP, senior leader within their community, and them talking, and them really being able to have space to share whatever they feel. One of the common things that I do want to share is what we've heard from resource groups is this notion of suffering in silence. And that probably is you if you have just been on this planet for the past year and seen news after news after news hit that either is triggering or traumatic in some form or fashion. And so what we have really tried to do was to create space. So some other examples of outside of the Connect at Circles is really doing some community chats. So we have really, from the FBRG side of the house, have engaged community chats to do a check-in. So if it's a monthly sync, we do that. We do the Ask Me Anything with our leaders. But I think most importantly, what we've done and what I've led with is vulnerability and transparency. One of the things that we've done with these community chats with these leaders, we've also heard not only are you suffering in silence, but it's this pressure of being on. And many have faced unprecedented challenges and disruptions of how they normally worked. And so, you know, for us as a company, we were able to do an amazing kind of leave package for people to take some time off. But what we heard from underrepresented communities within our resource groups is they didn't feel safe and confident to take the time off because they didn't want to be seen as someone who was slacking. And so what we did with our community check-ins with our leaders was have them be vulnerable, have them take leave, had them share real life examples and experiences of how they were juggling, literally had them exposed in a Zoom call or a Facebook call with their kids running around or just being chaotic. And what we wanted to do was really humanize the experiences, humanize what people were going through. And I think most importantly, people needed that signal and permission to take care of themselves. And so we understood that, we tackled that head on, we leaned in appropriately, and then we created this engagement model where we, at all different cylinders, really came to people where they wanted to be met. So that's pretty much what we're doing, what we're continuing to do, what we're continuing to iterate on. But for us, the advantage is having already that virtual framework Claire talked about, where we have Facebook Workplace, and really creating different groups for people to connect in, creating experiences where we're bringing to life virtually, moving some of our community summits and leadership days to virtual connections to maintain that spirit of connectiveness. So with that, I want to pass it over to Sean with Right Direction.
Thank you so much, Barbara. And first of all, I'd like to thank all the speakers. This was really a great and very informative talk. There was a lot of actionable items that I think we could all use as it relates to mental health in the workplace, as it relates to DEI, and just being more inclusive in general as a workplace. Before we go to questions, we would like to first thank the generous support from our funders, Takeda and Lundbeck, who have helped make Right Direction possible. And as Darcy mentioned at the beginning, Right Direction is a mental health initiative. It is completely free for anybody who wants to access the materials. Next slide, please. I'd like everyone to join us for our next virtual town hall, where we're talking about, Barbara talked about these fireside chats and being vulnerable. And in this next talk, Changing the Conversation in Workplace Mental Health, we will be speaking with 3 individuals from the Stability Network who have lived with experiences of mental health conditions, and they have been able to still achieve a very high level of productivity and been high achievers. So we'll talk to them about their struggles and how they were able to navigate during different crises in their lives. And that'll be on April 29th at 2 p.m. to 3 p.m. Eastern, and you can register at rightdirectionforme.com. At this point, I think we have maybe time for 2 questions. So the first question is for Dr. Glover. If all our speakers could turn on their webcams, please. Thank you. Dr. Glover, what should managers look for when it comes to depression, especially for employees from racially diverse communities? I think you're muted.
Okay, yeah, it took a while to unmute. So I think it can go a few ways, but I think checking in and asking somebody, like, there's a lot going on. I mean, right, like when my patients come see me, I don't just start off by saying, oh my God, another Black man was killed today. I start off by leaving it open and just saying, how are you doing? And there's a lot going on in our society, pandemic, and lots of upheaval, and then I sort of leave it to the person to tell me how they're functioning. And I ask, like, how is work? Are you able to focus when you need to? And from there, I kind of leave it up to the person, because managers are in sort of a tough position in that they may see an employee in distress, but they can't be intrusive about, sort of pulling out that information. Claire, I see you nodding your head. I'm wondering if you have some thoughts.
Yeah, I think at Facebook, we've tried to take on a lot of these conversations and encourage employees to connect with one another, but at the same time, making sure that allies weren't hearing that they should go and kind of over pivot, that people don't want to have to speak on behalf of their entire community when they're at work, and really being sensitive to that. So I think it's kind of a fine line of wanting to show up and be there without sort of making it about you and making it about like the ally, wanting to engage in the conversation, but really gauging whether or not the individual wants to talk about some of these things that are going on. Hope that makes sense.
Yeah, thank you both. Claire, it was an interesting segue, because I think, or not a segue, but an interesting answer, because I think it almost answers the next question, which was, when it comes to peer support, how do you train, staff and especially managers to deal with mental health at work and ensure that peers stay, mentally healthy?
So we don't actually have like a traditional peer support model for mental health. What we do is we have a grassroots model where employees are connecting, in mental health for example, or they're part of a club, or they're part of a Facebook resource group, versus a training program where we're training peers to be peers in that way. But what we do is we have lots of resources available that are very well promoted, so that employees all know as soon as they're onboarded, what's available to them, and reminding them to share those resources with their colleagues and friends if they see that that's needed. In terms of managers, we have a number of different kind of manager educational pieces, so that we are helping managers understand how to respond in specific scenarios and how to show up. And the message there is really making sure that managers don't feel that they need to be, they're managers and they're there to help support the employee get their work done. And they should not feel like a therapist or that they need to be diagnosing, right? And so it's making sure that they have enough information so that they can really refer people to the resources when appropriate, and loop in other supports who can help them in situations where something might be going on where they need additional support. So that's kind of how we approach that. Yeah.
Thank you. I see we're at time. We had several really, really interesting questions, and I'm sorry we couldn't get to them all. But thank you, everyone, for taking your time to speak with us, and we really appreciate it. Thank you.
Thanks so much for the opportunity. It's great to be here.
Thank you.